Many thanks for staying with us. Now let's go to health matters, where cancer remains one of the leading causes of death worldwide. In Nigeria, many patients are still diagnosed at an advanced stage, with the treatment options limited. As the world marks World Cancer Day, health experts are warning about the dangers of late detection and stressing the urgent need for awareness, screening, and timely treatment. All right, to discuss more on this, we're joined by consultant oncologist Dr. Demola Oyekan. Thank you so much for joining us. I mean, the world marks World Cancer Day, and honestly, there's nothing to celebrate because the number of mortality from cancer keeps increasing, especially in this part of the world. So my first question would be, why are so many cancer cases still diagnosed in the late stages, and how does that affect the or reduce the patient's chances of survival?
Yeah, so thank you for having me. It's important to know that people are not aware of some of these cancers. The ones that are common, really, like breast cancer, the way they present with lumps or pain or discharge from the breast. People may not really pay attention to some of those things, especially in women. The other cancers really are in some parts of the body that may not give a specific symptoms. We call them unspecific symptoms. And when that happens, they may treat it as maybe a minor ailment. Some treat abdominal pain as typhoid most of the time. And they go on and on visiting either pharmacies or a chemist shop, or just go to a hospital and they want to get treatment for typhoid. And once they feel better, they just feel that they are okay, rather than going forward to find out why that is persisting. So things like that would allow some of these things to thrive. Things like breast cancer, patients mostly present with a painless lump, all right? And because it's painless, they would rather say, oh, it's not really affecting me, so why do I need to pay attention to it? But this thing is increasing in size, it's growing, it's already causing some damage. So by the time they will present to us, we also have some systemic problems. When I mean systemic problems, I mean referrals. All right, so patient may actually pick some of these things, and before they get to the people that will really help them, it may take a lot of time. So basically, there are some people that will get advice from family and friends and say, okay, why not do this, try this, and all that. So before the patient eventually presents to the people that will really be able to help them, time has gone. And so these are some of the things that actually cause, people to present late most of the time. And then also, sometimes people would actually realize that even if there's something to this, even if this is a cancer, can I afford to get it treated? So, this is our Yoruba adage that says, what you don't know cannot kill you. So, they still believe that if you don't find out what it is, let me rather just sit still and not really do anything about it. So these are some of the things that propagate this attitude, this behavior. And a lot of awareness actually has been going on, and been trying through social media, through forums like this, to make sure that we pass on these messages, go to churches and mosques to ensure that people are aware that to pay attention to the things that matter when it comes to these symptoms.
Okay, you talked about overlooking some of these symptoms. What early warning signs, especially of cancer, do people commonly ignore or misunderstand? And again, what is the guarantee that even if they, notice the early signs and go for treatment, it can be tamed?
Okay, so for different cancers, there are different signs. Some are not specific. But for the common cancers like breast, it may just be a breast swelling, a lump, a swelling in the armpit, or abnormal discharge. For colon cancer, it may just be blood in the stool, noticing that you're constipated, or passing dark stool may be a sign of something going on in the stomach. For prostrates, it may just be nothing specific really, but I mean, we usually advise that people will check their prostate specific antigen, which is the PSA. So some of these things are, I mean, they are specific to different cancers, but what is common to all of them is unintentional weight loss, reduced appetite over time, weakness that cannot really be explained. All right, so these are not specific, but I mean, it can be associated with some of these cancers. That somebody is experiencing this does not mean that it is cancer, but the person should get checked. Now, to the second question, which is,
does it guarantee that it will be taken?
Yeah, so of course, I mean, basically, if a cancer is picked early, there are some cancers that can actually be cured. Things like breast cancer, testicular cancer, colon cancer. If it is picked early, you do go through the normal necessary treatment. I mean, it can be cured. And you know, cure is not when you finish treatment and we don't find anything. It is when we have followed you up for at least 5 years. That's when we can say, oh, this person has been cured. Instead of, I mean, when you finish treatment and, you know, people will just go away and disappear and they feel that. So we usually encourage that people, after they have completed their treatment, they should still continue to come for follow-up so that we can continue to monitor them while they are in remission. Then after a period of time, we can now say that, okay, we are sure that they've been cured.
So we've talked about how people ignore warning signs, but there's some people who do not ignore the warning signs, but do not have access or cannot even afford some of these cancer screening services across Nigeria. So what is the level of accessibility and affordability?
Yeah, so that's where the healthcare system comes in. And I mean, for me, I believe I'm doing some forms of advocacy here to appeal to the government to, you know, to invest more in health infrastructure and healthcare financing ultimately, because these things are not cheap. Cancer care globally is very expensive. From the screening to the treatment, they're expensive. But what will make it easy for people to be able to access it is to get people on healthcare insurance. About 90 to 95% of Nigerians are still paying out of pocket for some of these tests. So if you tell somebody that is selling foodstuff by the roadside to go and buy, I mean, to go and get treatment, I mean, give them money to go and get treatment, they would rather use it to maybe invest in their business or invest in property. So it's not really, it's also an attitude problem, in a culture of not really taking care of oneself. I mean, we prefer to just spend the money on something else rather to on using it to look after oneself. So these things are expensive. Patients can access it, but not accessible for everybody. So what will make it available or accessible to everybody is government interest to ensure that everybody is enrolled on the healthcare insurance so that it will be easy for them to access it, whether they pay or not. They may even pay a token, maybe a lower token for the healthcare insurance, and then they'll be able to access these screening programs.
Okay, so the challenge here is Nigeria has a growing cancer burden, right? But are there enough oncology specialists and even treatment centers to match the growing concerns?
No. So, I mean, Nigeria has a population of over 200 million, and currently we have less than 70 oncologists in Nigeria, trained oncologists in Nigeria. And then the treatment facilities that are available, we have them springing up. I mean, the government actually, they are doing a lot, but we don't have enough. They are springing off, trying to equip them. They are not yet properly equipped for us to be able to deliver this treatment properly. One of the important equipment that we use in cancer treatment is a radiotherapy machine. And as of now, I think we have just about 11 to 14 centers having these machines functioning to serve a population of over 200 million. It doesn't match.
All right. Well, we have come to the end of this conversation. I mean, I would have loved to continue the conversation. The world is marking World Cancer Day, but we are not seeing any significant, improvement, especially in this part of the world. And unfortunately, we're hoping that this will shine the light on, especially awareness. People should no longer take for granted the small signs. But we want to appreciate you, Dr. Demola Oyekan, for joining us. Thank you so much for your time with us.
Yeah, thank you.